I think we're all so used to going to a physician, getting an antibiotic because we have a strep throat or we have an infection, and what usually happens? 24 hours after you take the antibiotic, because it's for a bacteria, you feel better. The flu is a virus, and it has to run its course. And in running its course, that's 7-10 days that you might be sick, 2 or 3 of them, you're going to be very, very sick. A temperature that you're very sweaty, you may have to have someone help you change the clothes on the bedclothes or your nightgowns, and then you're very dehydrated. So you need to make sure somebody's coming in every half an hour and saying, here's a popsicle. Here's some Gatorade. No, you need to drink, because the culprit of this is 2 things. Dehydration, when people get very sick and probably end up going into a hospital and maybe eventually dying, and it turning to a bacterial infection. And the bacterial infection comes from us not getting up and moving around, not taking deep breaths, not being hydrated. So I think this is going to be a very interesting season. We may not see it. I'm not quite sure people realize how to nurse somebody who's got the flu. Remember your lungs? That's where we have all this fluid that's in there from this virus, and you're coughing and hacking. So just getting in a fetal position and staying there, that's when that fluid just sort of stays in that place. And that's how bacteria can start growing and the pneumonia could come. So getting up, taking a deep breath, going to the bathroom, stretching, that's why we do that in the hospital. That's why nursing says to you, whether you're hurting or not, get up. So there is a real scientific reason to the mobility of helping you to stay well. So that means conversations. You have to have a family physician that you can get in touch with. Tell them your symptoms over the phone. They'll look at you as your risk. Is this something that you might be able to weather, or do I need to get on top of it right away? It's really a case-by-case basis.
It is, and currently the supplies of the antiviral drugs that you mentioned are limited, and they're reserving them for the sickest people. So they're not giving them to just everybody. They're really reserving them for folks that are hospitalized and are severely ill.
You're really the most contagious before you get sick. And then we call that shedding as you begin. You don't even know you've really gotten the flu. And then with the graphs that we showed in our presentations went anywhere from 7 to 12 days. Kids can be a little bit longer. But it's really those first 3 to 4 days that you feel the worst. And what we're asking people here at Haney's is to stay home until you don't have a fever and you don't have symptoms.
CDC is asking folks to stay home for 24 hours after you don't have a fever without taking any anti-fever medications. And when I say anti-fever medications, aspirin, ibuprofen, those types of pain relievers.
Yeah. And let's talk about a waiting room and emergency room. First of all, you're coming in, you're sick, with people with immune systems that are different, like he's talking about. It's the wait time, and what exactly are you asking someone to do for you? So the real answer is, what can an emergency department do for you, that you want? See, that's the trick. And I don't think people use the emergency department many times as a family physician, and we really need to discourage that for this.
We really want to reserve the emergency departments in hospitals for people that really need it there. The most ill, people that have acute illness, and for all the other regular things that are going to go on aside from the H1N1 in terms of car accidents, trauma, heart attacks, strokes, and the emergency departments really need to be reserved for the people that are very ill. Most people with H1N1 have like a mild to moderate illness and recover quite nicely on their own at home. Some people do have a more severe illness, possibly very healthy people, more likely people who have other health care conditions. If you are having severe difficulty breathing, if you're having chest pain or pressure, if you have vomiting that doesn't seem to stop, or if you have a fever that's not responsive to any of the anti-fever medications, that would be the time to go to the hospital. An emergency department in a hospital treats people based upon their acuity. The most severe people are treated first. So even though you might feel like you're dying, the staff at the ED might come to the conclusion that you're not rather quickly, and you might be in for a little bit of a wait. They're going to put a mask on you. They're going to isolate you. If you're in doubt about whether you should or shouldn't, you probably should go.
The nurses or physician assistants or nurse practitioners usually do the triage. They're looking for everything we just talked about. I'm looking at your color. I'm looking at how you're breathing. They usually take your temperature right in the chair as you are answering and giving your insurance card, okay? If any of those things are in jeopardy, you're going to be put in a wheelchair and brought to a bed in the back room. If for some reason that you have a temperature of only 99, your color is good, you're talking and walking, I'm going to find a separate room for you. They usually have a separate room and ask you to wait. and eventually you'll be brought back, and somebody will look at you, listen to your lungs, take your temperature again, and tell you you have the flu.